everybody, it's Dr. Gandhi. Just want to take a few minutes to talk to you about urinary incontinence, specifically after childbirth. Giving birth is one of the most beautiful things, and you'll never forget how amazing it was to share that moment with your significant other, bringing a life into the world. But there are a lot of changes that happen to our bodies during pregnancy, as I'm sure a lot of you know. And one of the very important things that I wanted to discuss today is doing things to help your pelvic floor be strong. Be strong for the time of delivery and be strong after delivery. We don't harp on it enough, but it's really important to do pelvic floor exercises starting in your early third trimester if there are no contraindications. And this means to kind of help strengthen the muscles that are in and around the bladder, so that the functionality of the bladder is maintained after childbirth. When you give birth, there are a lot of changes that happen in our ligaments around the supportive structures in our pelvis, and they respond to a hormone called Relaxin, which helps, relax our pelvic floor to help accommodate the baby that's coming through the birth canal. During that process, we may experience some of the changes that are associated with that. Maybe not able to hold our urine as well, or a small amount of leakage when we exercise or we go to pick up the baby. And it's really important to continue the pelvic floor exercises even after. And the other things that are important lifestyle-wise is to maintain a healthy weight. Try to maintain the weight gain during pregnancy in the recommended amounts of 25 to 35 pounds, unless there's any other, specific instructions with your physician. And then you also want to make sure you're concentrating a lot on not getting constipated and drinking enough water. Those are all things that can exacerbate any leakage issues. When you come in for your postpartum visit, it's really important to talk to your provider that's seeing you about any issues you're having with leakage, because there are many things we can do to help you so that, one, perhaps it can be cured and you don't have to worry about this problem long term, or two, help you maintain the support that you have, and even prescribe pelvic floor exercises specific for the needs that are related to your anatomy. And then third, you also want to consider other things that are causing the leakage to get worse, whether it's environmental factors like your diet or lack of exercise or your weight, but also other things that could be anatomically related, like prolapse, or things that are surgically needed to be corrected. And we are here to help you because we want you to obtain your optimal health so that you can enjoy your baby, but also enjoy being a healthy woman with the prospect of living life without having to deal with some of these issues. The bladder's main goal is to empty and store urine, and so if you are having issues with either of those functions, it does affect your day-to-day life. And I just urge you to not be ashamed of it, but to talk about it, because there are things that we can do to help you. And you can always call me Dr. Gandhi. I do urge you to do the pelvic floor exercises. I hope that this video has helped you, and if you have any questions, please call us.